Hello, happy Monday, everyone. We are getting ready to dive into quick facts. This is Monday Motivation across the nation. My name is Professor Regina Callion, and I love what I do. Nursing, all things nursing, guys, all things passing NCLEX, helping you get to your goal. It's a beautiful time to be a nurse in the United States. I'm just going to say that. And I know that people could be talking about everything else, but nursing in the United States is the best country ever. And so, if you want to be a nurse here, I'm going to help you pass NCLEX. We are talking today about cerebral vascular accidents. And I am here for only one reason. I feel that there is a point about CVAs that you have missed. I feel that there is a point about CVAs that even though you have this book, you might have missed the huge point of it. So let's get into it together. Are you ready? If you're ready, put ready on the screen. Remember with ReMar, because we study the way that we do, and because we have seen the transformation of nurses who have failed the NCLEX 2 and 3, 4 times, but they come back to pass after studying this way, which is really a remedial way. What we're about to do is remediation. We offer pass or your money back. That's it. We offer pass or your money back. Now, I am ready. I see that you are ready. So let's dive into it. We're gonna do quick facts for NCLEX until my phone dies. I really need a charger, but I'm about to just push forward in faith that the Lord will supply all of our needs here. All right, so let's get out. And then, so we're going to do quick facts for NCLEX, and then we're going to do just a short motivational piece that I think will be extremely, extremely helpful for us. Okay. Also, tell me your story. Okay. We did the discount program. Last week, and people were calling in, telling me their story. People were writing in, telling me their story. People were emailing me, and we were able to give them discounts on that. So I am looking forward to hearing more about your story too. I want to know what's working for you, what's not working for you. Let's start there. Okay. Let me know what's working for you, what's not working for you. All right, we're going to dive into it. So, quick facts. Cerebrovascular accidents. What we need to understand is the hidden priorities, because this is the question I'm starting with today. All right. This is the question I'm starting with. When a patient has a CVA, what is the most important thing for them to recover in a holistic way? Is it medications? What is it? What is the thing that's going to make them recover? Okay. All right. So that's what I want to say. Cerebrovascular accidents, though, is okay. I don't even know how. There's so much here. I'm looking at it. Okay. I'm looking at it and I'm wondering to myself, how do I even begin to start this topic? Let's start by just the name. Okay. The medical term for cerebrovascular accident is there. What's the layman's term for this? What does your grandmother call this? Or what does your aunts and uncles call this? Well, what do they call this? Let's start there with just the vernacular, because this is a cultural exam. A lot of reasons why international nurses don't do well with NCLEX is because it's very American. It's very American. So we call it cerebrovascular accidents in the common, in the medical room, the classroom, but it's a stroke to our grandparents. Okay. It's a stroke to our grandparents. And we know that not all strokes are the same. Okay. That's number one. Not all strokes are the same. But let's break down the term here. Cerebrovascular accident. So when you see the word cerebral, what organ do you think of? Put it in the comments, because y'all going to have to help me teach this thing today. It's Monday, and we got to get all on the right path, okay? When you see cerebral, we always think brain, okay? Now, when you see vascular, that represents the blood vessels. And so it's not just, watch this, it's not just arteries, it's not just veins, it's both. It's arteries, it's veins, it's capillaries. And the term here, accident, is relevant because this is where you have an accident of the blood vessels in your brain. And that accident can look like what? It is a reduction of the blood flow. So the job that those vessels are supposed to be doing, they no longer are able to do. Right. And I see the comments here. Yes, you guys are talking. I'm on page 23. Yes, you're talking about the types of accidents, right? It could be a blood clot. It could be a hemorrhage, right? It's something that's not supposed to be there. So here's a question that I'm asking you today that we kind of built up on a few weeks ago. When we talk about this reduction of blood flow, does quick facts tell us that the brain cells will be damaged? Yes or no? Are the brain cells damaged? Yes or no? Again, with cerebrovascular accidents, are the cells of the brain actually damaged? And this is the difference between being a safe nurse and being a nurse that can pass tests. Because most of the NCLEX is multiple choice. And so just being able to recognize something is different from being able to inherently understand it. And so the work that we're doing right now is that remediation work. So the brain cells are damaged. And I would agree with you, they are damaged. Here is the critical thinking part of knowing the facts. It's good to know the facts, but it's also great to know if you can critically think. Okay. Here's the critical thinking question. Are the brain cells damaged permanently, or is this a temporary thing? When we talk about cerebrovascular accidents, meaning are the brain cells able to reverse their condition? You know how like some organs, they can heal on their own if you give them time, and then other organs are not going to be able to heal. Mhm. Temporary or permanent? And so I know I have asked a critical thinking question when I see the classroom divide. I know I have challenged you because I see the classroom has divided. Some are saying, "Oh, yeah, of course, yes, of course, it's temporary, it's permanent." All right, here's where we separate ourselves from the others. Okay, this is a permanent damage to the brain cells. Okay, this is a permanent damage to those brain cells. Now, with that being said, does this patient still have hope? Does this patient have hope? And if so, why? Are people with strokes lost causes? That's what NCLEX wants you to be able to know, to be able to have the understanding and be able to have the empathy for. Okay. And I think that's what we miss when we don't walk it out. When we just read it, we miss. Okay. Some people are saying, yeah, they're hopeless. They don't have, yeah, no. Some people are saying, yes, there's hope. All right. I want you to chew on that for a bit because we need to come back to that point. Is this a hopeless situation? Now, let's go on. The three most common causes of CBA are embolism, hemorrhage, and thrombus. It's up to you to know those terms. I'm not going to define them. You should know that. Okay. I want to go down though, because you should know the difference between CVAs and TIAs, knowing that patients can have an event that looks like a stroke, but it's not a stroke. It's a transient ischemic attack. Okay. Know that those are things too. I'm on page 23 of this book. But here's a question. When you talk about a patient having a stroke, you will notice that the side of their disease process is going to have an interesting relationship to where you see that functioning happening. Do you know what I'm talking about? Um, If the brain and the sensory motor neurons control opposite sides, what happens if your patient has right-sided damage? What are you going to see? Okay. And again, this is just this is a foundational point about cerebrovascular accidents that you must review in order to be able to critically think. Okay. Mhm. There's so much here. Okay. Exactly. Opposite side. So if your patient has right-sided damage, I love it. You guys are teaching in the comments. There's going to be left-sided weakness. Okay. Now, most of you know that. Okay. Most of you know that. What you need to go further and deeper into understanding, because the physical is cool. We know that if it's on the right side, then they're going to have left side damage. That means they're not going to be able to use their left arm, their left leg might be weak, they might slouch a little bit. That's easy. Okay. NCLEX is going to anticipate that you know that. Those nurses who don't even know that won't pass the exam. They're going to take it a little bit further though, and they're going to say, knowing what you just know about opposite hemispheres, if your patient has, and this is why we come to class, okay? This is why we come to class on Mondays and Wednesdays, all right? To help us to move into the next level, okay? So if your patient has difficulty speaking, is that going to be a left-sided hemisphere, or if they have a right-sided hemisphere damage? Okay. That's what NCLEX wants you to know, because it's just as easy for you to know that as it is for you to know physical changes, right? So I see people put in the comments, is it left or is it right? Is it left or is it right? Okay. All right. If your patient gets up and doesn't think about whether they'll be hurt or not, is that left-sided or is that right-sided stroke? If your patient would jump down the stairs, is that left-sided? Is that right-sided? Okay. And if you don't know this, you need to know. I'm going to give you a really easy way to remember this. Okay. But I want you to write it down. Okay. I want you to write it down. Not bad though. Not bad. Okay. I like it. I like it. I like it. Okay. If your patient, what else can I say? If your patient takes a fork and sticks it in their ear, is that right-sided or left-sided damage? Okay. All right. And this is why I say this is a great place to start, because understanding the core facts of something is going to help you to be able to critically think. And you guys are actually doing quite amazing in the comments. I know that you have been studying. I know that you've been studying. Okay, so just really in general, for those of you who don't know, whenever you talk about stroke, and I'm gonna wrap it up right after this next point. When you think about the left-sided or the right-sided damage, remember, if there is left-sided damage, the patient will have issues with language. There's an L in language, there's an L in left. So that means the aphasia. That means all of the issues with knowing what to say and answering inappropriately. That is left-sidedness. Okay. Now, right-sided damage will present as reckless behavior. That means patients that are impulsive, patients that are they're not safe. They don't think about it. They're pulling out their IV lines. They're pulling out their catheter. right? They're hitting you. They're yelling and screaming. They are just totally reckless. And even though reckless starts with a W, it has the R sound, right? So you can remember that. You can remember that and you can do well. Good job, Crystal. I like that in the comments. Yeah. Okay. That is something that will just help take you to the next level and being competent and being confident. Okay. And it's your responsibility for professional growth because too many people in our communities have strokes. Too many people in our family have strokes, and you are the house expert in your family. You need to know this stuff. Okay. There's a whole nother page on cerebrovascular accidents on page 24 as well. I want you to read this, okay? I want you to read it and I want you to understand it. I'm going to go back up to the point that we started off with in the beginning where we talked about whether cerebrovascular accidents had permanent brain damage or temporary brain damage, and do these patients have hope? Okay. I also asked you what is the most important part of the treatment plan of somebody with a stroke. Those were the two critical thinking questions that I asked you. Okay. So the first question, the answer to that is yes, the brain damage is permanent. When you lose a brain cell, it cannot regenerate. That's why we tell our kids don't use drugs. That's why we tell our kids don't do stupid stuff. Don't use drugs. Don't drink alcohol excessively, because when those brain cells become poisoned and die, you stay incompetent. Okay? Huge point. You have cells in your body, like your liver cells, that help you. But when you get rid of a brain cell, it doesn't come back. So, why is there hope for these patients? Hope for these patients exists because of this. The brain cells that are healthy and active will be able to adapt to do new jobs. Okay? They'll be able to adapt to do new jobs. So that means the job that the dead brain cell can no longer do, somebody else will come off of their duty and begin to take over that brain cell's job. Now, you may say that there is not a God, but that is an amazing creation that just does not happen by accident. What I'm saying is that, okay, if you learn something new, that's the bell for new knowledge. Okay, when you hear that bell, that means it's going to be ingrained into your mind that brain cells have the ability not to regenerate, but to adapt. Okay, so if that is true, then they must be trained to do that. Okay, so if that is the case, the most important part of a cerebrovascular accidents patient's treatment plan is what? If you have to teach your patient how to do new things or things they forgot or things that they used to do but can no longer do, there you go, Imani. The most important part is physical therapy, occupational therapy. This is why the therapists are so important to the treatment plan of a stroke patient. And when nurses don't have that knowledge that you just had, okay, they don't encourage stroke patients to do their PT or OT to the aggressiveness that they should. Okay? Because stroke patients will say, I don't feel like walking today. I don't want to do physical therapy. And the nurse is like, okay, listen, I can't argue with you. You don't have to do it. Okay. But a good nurse that is knowledgeable will say, if you ever want to learn how to do this, your brain has to develop new experiences. Okay. Your brain has to train cells that are not used to helping you walk and not used to helping you think to do it. Okay. That's it. That is what most students miss when they study cerebrovascular accidents. The importance of the interprofessional developmental team. I mean, if you ever wonder why physical therapists come in and they, some nurses get annoyed with PT because they come in, they get our patients all upset. The patients say they're in pain, they don't want to do it. These are some of the most important healthcare individuals that we have. All right. They make these patients' life livable. So I love physical therapists. I love occupational therapists. I can never do it. Speech therapists as well. Can never, would never, because I'm a nurse. But that's what I wanted to impart with you guys today for our lesson. Again, when you're studying subjects, if you study in a way that is remedial, that is relevant, that is consistent, you will see progress. Okay. And that's just with anybody. That's not a promise that I'm making you. It is just real life experience. Okay. And you have to do that if you're going to be a nurse. You have to do that in everything. And I know this is the era of Chat GPT, and I know this is the era of using technology to have shortcuts. But the reality is that when you're at the bedside and you're with a patient, you cannot rely on Chat GPT to be a filter for you and another human. Now I guess I'm old school now, but when you're talking to a patient, you need to be able to understand the reason why you're there. And if Chat GPT has to tell you the reason why you're there, you're going to be replaced. All right. All right. So that's it. Now, if you have learned even a little bit today, your Monday is progressive. You are going to be more confident. You are going to be stronger. I do want to leave you with this thought too, because it's not just about you being strengthened in your knowledge about nursing, but also this concept that I have that God is in control of every day. Okay. God's plans don't always match your plans. And there is a scripture that is really familiar with the Christian community. Let me know if you've heard this before. It's Romans 8:28. And when the pastors say it, they're usually saying it when things are bad. And they say, and we know that in all things, God works for the good of those who love him, who have been called according to his purpose, right? It all works out for the good. This is so relevant to us today because what God is trying to tell us with this scripture is that not all of your moments will be good, but they all can be used for good, which is a different thing, right? Not all of our moments in this life are going to be good, but God is going to use them in his timing and in his way for the good. And this is specifically for the good of those who love him. Okay. So God, he's not all about your comfort, but he is about what is good. And those two things can be very different and difficult to process. I said, God works for our good, not for our comfort. And so he's promising us that when we walk through difficulty, he will use those circumstances to help us to what? Know him more, know him better, know him in a new way. When things are good, sometimes we don't even think about God. We're just enjoying the good times, right? Some of us have to be pressed down. Some of us have to be in trials and tribulations before we look up and say, God, I need you. Like, I can't do this on my own. And so don't be surprised at the lessons that help develop your character. Okay? God works according to his purpose, not ours. And that's the hardest thing because we like to be the main characters in the story, but our plans and our desires usually are very temporary and they usually only evolve around us. We have a very limited perspective. We can't even see 5 minutes into the future. You literally don't know what's going to happen at dinner time. But God sees it all, the Alpha and the Omega. He already has saw the end of your life, and he's back with you here today telling you, keep going, keep going, keep going. Don't give up. And God isn't working in all things in our life, not just the big things. Passing NCLEX is a big thing. We are trusting him for that. We want him for that. But even in the little things, even in today, you having your daily bread today, what you have access to, what you will eat, what you will drink, what you will wear. God cares about those little things too. And so nothing is too small for him. Nothing is too big for him. But in order for you to trust him, and this goes back to anxiety, in order for you to trust him with the big things, you have to be able to trust him with the small things. And the small things are your daily decisions. Get in the habit of giving it to God, even the small things, right? The next few minutes. Don't hold on to it, okay? Because sometimes you are not going to be comfortable, but you do have to be able to endure. I was thinking about this concept, and I'm going to stop here. I was thinking about this concept of death and why we have to go through it. Sometimes it makes me angry that we have this one enemy, all of us, no matter who we are, no matter where we come from, we have the same enemy at the end of our lives is death. And in church, they always say, well, God defeated death and he has the keys to the grave. And I'm thinking to myself, okay, I'm so grateful for that. But then why didn't you just get rid of it? Like, why did you defeat it, but it's still here? That's how I talk to God. That's how I talk to God. And God reminded me that the last enemy to be defeated would be death. And it has to come at the time that he says that it has to come so that the plans of God are revealed to everybody. And the reason why he has not yet come is because I still need mercy. I still need character development. I still need to experience his grace and his fullness. Don't you love when God puts you in your place? I'm asking for something I'm not ready for. I'm asking for God to wrap this whole thing up, and I might not be ready for it. And that is how you know you have a good parent, is because they don't give you something that you're not ready for. Some of us are asking God for a husband, a ministry. We're asking God to put us in places that we're not ready for just yet. And so we have to be okay with understanding that his timing and his way is the perfect way for us. Okay, I'm done, y'all. Thank you guys so much for attending. Thank you so much for attending Monday Motivation, our study session. If you like what you just experienced, go ahead and follow this channel. Go ahead and send a like here. It absolutely helps me to stay encouraged. It absolutely helps me to stay encouraged in my ministry here, which is much bigger than just passing NCLEX. And so I'm grateful for that. I'm grateful for that, guys. All right. I want to say goodbye to you. Have a great week. As always, you guys know I believe this. You got to receive it, though. You got to receive it that you can, you will, and you must pass NCLEX. And do me a favor. Tell me your story. I'm still doing the tell me your story because it is so relevant if you failed NCLEX multiple times, if you are a mother, oh, I was talking to some people. I was talking to some of y'all on TikTok. And y'all just blessed me on Friday. I got a chance to just rap and go back and forth. And there was a mother that's going through a divorce, and I was like, but she is encouraging herself and her kids, and she is pushing through. And I'm like, yes, sis, this is what needs to be made known, is that it's not going to be easy, but you doing it is part of your journey. So tell me your story. My email address is on the screen. If you see it, check it out. I love to hear from you. Again, it's Monday. We're going to start our week strong. But we're believing that we don't have to do the work. I love this when I heard this. Our job is to keep our minds stayed on God. He will keep us in perfect peace if we keep our minds stayed on him. So your job is not to have perfect peace, is to do what? Keep your mind stayed on God. That's what you have to do. All right, guys. Thank you so much. I want to hear from you. So shoot me an email. Let me know what you need to get to the next level, whatever that is. And as always, you can, you will, you must pass NCLEX. See you guys later. Bye-bye.